Today I'm going to speak to you about fungal nail infections. Now, we do have a separate video on fungal skin infections, so if that's the one you need, then you need to head there. If you have both skin and nail infections, but then please do watch both of these. Now, fungal nail infections are a whole different kettle of fish compared to fungal skin infections. Essentially, it is a skin infection which lays beneath the nail, but then the nail acts like a coat of armour, if you like, preventing a lot of treatments for actually getting down to those fungal cells in any doses great enough to actually affect any change. So there are many different therapies trying to work on combating that kind of armour plating, if you like. But ultimately, you can catch fungal nail infections from skin infections and vice versa, fungal skin infections from fungal nail infections, because they are essentially all the same thing. But just trying to get underneath that nail plate is really difficult, and therefore success rates are far less with fungal nail infections. Now, where the infection doesn't affect the base of the nail, this is where the cells that make the nail are made. Now, where the fungal infection lays higher than that, you have more options. Once it's down and it's crept down to those areas, it becomes very much more difficult to treat. When it is down there, the best thing on the market is something that is a tablet from your GP, but you can only get it on prescription, because it can carry loads of side effects, and so your GP will need to monitor you on those. So unfortunately, it's just not suitable for everybody. If you're generally fit and well and you don't have any other health complications, then it is a viable treatment option for you. If you do have other issues, then it's unlikely that it's going to suit you, so it isn't an avenue that you perhaps be able to go down. So what do you do then? What do you do if you can't take that medication, or you prefer not to? Because many people just don't like to take medications where they don't absolutely need to. And do you need to? Do you need to treat it? Well, ultimately, a fungal nail infection is very unlikely to cause you any health problems whatsoever. Theoretically, it can increase the risk of bacterial infections, but ultimately, fungal nail infections aren't really going to cause you any problems. So you can live with fungal nail infections reasonably comfortably forever, but they can look quite unsightly. It can make the nail quite thickened, discoloured, crumbly, and so people often would rather they just weren't there, because it just doesn't look nice. And so if there's any opportunities where you need to get or times where you have to get your feet out, people can feel very self-conscious about the way that their nails look, and so want to do something about them. So like I say, there is no quick fix for fungal nail infections. You are going to be treating these nails with any topical treatment, so that's not the tablets, for at least 12 to 18 months to stand any chance of actually getting any success. So what options are available to you for things that you put on your nail? So here at the clinic, we offer a few different sort of treatments, if you like, in trying to address fungal nails, and then you also have other medicaments and things that you can use that you can often buy over the counter. So we'll start with the ones that you can buy over the counter. So there's one that we stock here. This is called Emtrix. Essentially what this does is you paint it onto the nail, and it creates like a kind of a gel film over the top. Now, it has a product in it which helps to open up the nail, if you like, make it a little bit more porous, and that it also kind of slightly bleaches the area, so it can give the appearance that the nail looks a lot healthier and a lot nicer. And a lot of people do feel this makes the nail look better, so you get more immediate results with this one, but ultimately, as an antifungal on its own, it's not overly great. But what you can do is you can use it in conjunction with an antifungal. So popping this on in the morning, which opens up those porous areas in the nail, if you like, and then adding an active antifungal on. Now, this isn't a licensed treatment, but there's been no problems like kind of highlighted with doing this. So that's one option for you. Another option is something like this, which is essentially the same as like your Cura nails. Now, you thin down the nail with all these treatments. Trying to thin down any thickened nail as much as you can is really important. So you thin down the nail, and you can come to us to do that. Initially, we can get it right down there, and then you can paint over the Cura nail or the Morphine, and that has got properties within it which help it to get through that nail plate, through that coat of armour, and address the issue that is lying beneath. So again, that can be quite helpful. Now, the treatments that we offer here are working along similar lines of kind of both of those. Now, one of them we offer is where we use a chemical, and when I say a chemical, it's it's a urea. We use a very strong urea-based cream, which is a blooming good moisturiser, but also what it does is it soggies up that nail. It pulls loads of moisture into that nail and soggies it up so that we can remove it very painlessly, and that then allows you access to the skin beneath so that you can actively treat it then with your antifungal. So we do that treatment here. We also do another one which is called fenestration, where we make tiny little holes, little micro holes in the plate of the nail using a little burr. It sounds awful, but it's really not that bad. It's generally pretty painless. The worst you feel is a bit like a little ooh, like if you're plucking a hair or something like that, but generally it sounds a lot worse than it is. And again, by creating like these little holes, you're allowing a product like this terbinafine in a liquid form to go through those holes, and it kind of, it just helps you to deliver that medicament to the area in quantities enough to actually cause a positive effect. So there are those treatments available. And like I say, there is also the medication if you do want to go down those lines. We can also do like treatments like the keratolytic one where we put the urea cream on. We can do that in conjunction with oral medication. That's like a triple pronged approach, if you like, in trying to remove this fungal nail infection. Now, a really big part of any treatment is preventing reinfection, because you don't want to be going round and round in circles. So one product we really recommend that you use with any antifungal treatment is this one. This is brilliant. It's a really good all-rounder. It's antibacterial, it's antiviral, it's antifungal, it's also sporicidal, which is really important when you're trying to prevent reinfection, because like we say, they emit spores into the surrounding areas, which includes your socks and shoes. So you need to be actively treating those as well to try and prevent this and break this cycle of reinfection and infection. Now, what we recommend is using an active antifungal when you have a problem in the morning, and then spraying your feet with the Clinicet and inside your shoes in the evening, and rotating footwear so that you have more than one pair of footwear kind of in your general use. By doing all of those things, you do stand a far, far better chance of a successful outcome. However, nothing is guaranteed. This is a really annoyingly difficult thing to treat, and it takes ages. Like I say, it takes a good 12 to 18 months for any of these treatments, because it takes the nail a good 12 to 18 months to grow a full nail, and you've got lots of things working against you rather than for you. So if you'd like to have a chat to us or ask us any questions on what we can offer you, what there is out there for you, then please ask away. We're more than happy to help you, and I hope you found that informative. Thanks, bye.